Everyone, so welcome today to my new video. Today I will be talking about successful examples of doctors who got jobs only with AMC1 and they were offshore. So I will be showing the real CV they wrote and how they structured the CV. So just to give you an idea that a CV is a simple document of what you present or what you have, and you really don't need to pay any expensive services to get your CV written. There is no one that knows about yourself better than you. You're just writing it in a normal document, organized with no mistakes, no grammatical errors, and that's it. So let's start with the first example. So we have the first doctor here. So the CV starts with her personal information, which are hidden, and then you have the professional statement where she speaks about her medical training. So she had 5 years of experience. She passed her AMC1, and specifically, this doctor got a job for months after passing her AMC1. She's a doctor from South Africa. And here she had her qualifications after talking about herself. So, Bachelor's of Medicine Fellowship exam of South Africa AMC and PTE, so only with AMC1, and she did not have any visa or any working rights in Australia. And then she stated all her job one by one. So I just added the most recent one. So she was actively working, and all her responsibilities are here. And then all the presentation she did around her career, and then all her CPD hours. And if you see, it's just wherever you do during your learning, during your med school, during your work. If you did a small teaching, just put it there. If you did a small presentation, just put it there. It doesn't have to be anything fancy, to be honest. And the research and audit she did during her career as well. And then the clinical skills. So she puts all the competent clinical skills she had and the ones that she observed. And that's it. And I'm just want to show you the idea of these videos to show you the formatting. So it's the same format that I shared in one of my first videos in this YouTube channel about how I formatted my CV, because I formatted it the same. So this doctor did not take any courses or any services to get her CV done. And she nailed it and she did it very well. I remember at some point she was telling me, I'm losing my patience. I will never be a doctor in Australia. I was like, just keep applying. And that's the only thing. And even if you look again and again at CV, your CV is your CV. There is no magic CV. There is nothing that you can go beyond and above. It's just like your CV. There is no magical CV that will immediately get you a job. You go through rejection. She got through a lot of rejections, but then finally she ended up getting a job. This is the second CV. So I did put two different, very different CVs. So this doctor is a recent graduate from 2023. She had a program, which is a mixed program in Europe and the United States, but she did not have any working experience. So she graduated, but she never had paid work as a doctor. And we were not sure if APRA will accept that, if she will get a job with that. And the only way to go is go for the AMC1, do your AMC1 and apply. And she got a job, I think 3 weeks, 4 weeks after applying, she got an interview call after her AMC1. So it was very quick. So again, you have your professional statement, which is short, your information here, and then your professional statement, your qualifications, and then AMC and the English test. And then what she's done in practice in history. So she was an IMG academic coordinator, so that she was working on an academy online. She also did some during her after her med school, she was doing some research which is unpaid and also online. And also she did some clinical attachments who were unpaid in Gen Med, Peds and Women Health. She did her internship as part of her final medical school year. So in Europe, we don't have a paid, in most of the countries in Europe, not all of them, we don't have a paid internship. Even myself, my internship was not paid, but it's part of my final year of medical students, and they count as an internship. So that was her one that was here. And then she did some electives and clerkships that were also unpaid. So basically, she never had a paid clinical experience, but she always kept active. She always kept doing rotation, voluntary work, teaching, and that's sorts of things help. And then the clinical procedures she had, and then the CPD hours she had. and also the awards and distinctions and the research projects. So she kept active in research. She has some manuscripts in review and progress, and one of first author, which is great. So this is another side of the story, which is not really, you don't need 5 years of experience, which is the first CV that we had. You can get a job with less experience. It's just the way you format your CV, the way you write your cover letters, and also your luck. And I think as well, having a European degree, having experience in Western country helps a lot in getting your CV up high and stand out more. And this is my CV. So very basic professional statement. I know all these CVs sound the same and they look the same, but basically this is our format. This is the format I shared in my first video in this channel. So just go there, download it, and you can use the same format. The idea again of this video is to show you that you don't have to pay any service for such a simple format. You just have to write what you have done so far. So I also had very little experience from Spain, but when I was in med school, I did a lot of things. I was rotating did electives in Spain, Norway, and also did one in Australia. And I only had AMC one as well. So these are the things I had. And then I also worked as a teacher for AMC1, and I still working as a teacher for AMC1. And this is my only experience basically. So only 3 months where I worked as an HMO in ED in Spain. And then I did my internship, but that was again unpaid and was part of my medical degree. And all the medical electives and observations that I did were part of my med school. So as a medical student, you have more opportunities to go overseas and do things. Once you are a doctor and you're a graduate, it's a bit more difficult. And then the clinical procedures as well, and the CPD courses I did. And then awards, that I did some awards from, some grants. All this was during my med school. Like, it's nothing impressive, to be honest. It's just like small things that you do during med school. You just add them. I never had a research published. I worked as a research assistant in some projects, but never anything published. I did a final thesis that we all have to do, which is mandatory, but never published as well. So I'm not a first author yet of anything. I didn't have advanced life support either. So these are the things that, you put them there, they look nice on your CV, but there is no secret factor to get a job. I think the most important thing is your clinical exposure that you have. The more experience, the better, of course, but still there are chances for people who only have internship. So it's not black and white. It just make a good CV and apply. And that's the only way to know if you will get a job or not. And then I want to see that they are not only these two that I'm sharing with you, but if you see, I have someone here recently in October 2025, they told me that they got a position only with AMC1. This doctor got a position as well, only with AMC1, but they had very good experience. So I will tell you a little bit more about each one of them. So the first doctor got only with AMC1, I think 1 year of gap, living in Australia. Second doctor got only with AMC1 from India, had good experience in surgery. This is in a message in Spanish, but this is someone who got also job for an intern position after AMC1, only a few months after AMC1. And basically because they sent an email with their CV and they accepted to give him an intern position. I'm not sure about the gap, but they were living in Australia, so they were not actively working. And this is someone else who got a job offer from 2 hospitals. They had AMC1 and AMC2, and they were from overseas. So if you see, the pattern is very different. It's a mix of pattern where you have people with gap, people with only AMC1, people with AMC1 and AMC2, people with a lot of experience. I have heard stories of everything. I have heard stories of getting jobs with 10 years gap, but they were living in Australia. I have heard jobs about getting internship position while they are overseas and never had been in Australia. So everything is possible. Just prepare your CV, apply. And all these doctors, at some point, they were like, oh, I'll never get a job. It's so hard. No one is accepting me. They all went through a lot of rejections, a lot, but then they got it. So it's not impossible. You have to apply, but there is no guarantee, of course. That's why I don't do any CV services or anything because I cannot guarantee anyone a job. So you have to apply to know your chances to get a job. You have to be active in it, but at the same time, you have to be very clever, and at the same time, you have to continue progressing in your career. So that's a very important thing. You don't, so you can spend 1 year applying for jobs, but on the same side, please keep progressing in your career, keep doing courses and adding them to the CV. There is no single magic course that will give you a job. It's just the combination of all factors. Get into residency in your home country, even if you have to leave your home country later on, but it will look great on your CV. It will give you experience. At least you may be here in Australia in 2 years rather than never. So on those 2 years, instead of crying and facing just rejections and not progressing in your career, you should look forward, progressing in your career, do ultrasound courses, do emergency courses, get into your residency and continue applying and applying and applying. That's the only way to get a job. There is no, again, there is no magic CV to get you a job. CV just has to be formatted well done, well organized, no mistakes. And you just keep applying. And that's what we all did. And I saw this the other day from this hospital here in Australia, and it's in January 2025. Oh, sorry, I forgot to mention that all these messages are from 2025 or 2026. This is recently now from 2026. And I saw this in a post from a hospital in Australia. So they are welcoming IMGs. So all of these are IMGs. I don't know, AMC1 or AMC2, but they have got jobs in Australia as an intern position as well. So it's possible. Okay, I don't know them. I don't know any of them, but they published it on their Facebook page. So again, message to take home. You don't need to pay someone for a very expensive CV. You have seen the CVs. They are very simple. You know what you have done. You know your teachings, your research, your clinical experience. Just write it yourself. Keep it simple, clean, no mistakes. Keep applying and keep progressing as a doctor. And I will see you soon in another video where I will be talking about how to write your cover letter, which I already have a video on cover letters, but I will be showing real examples of cover letters. Thank you.